this is where we're going to be starting to go through, okay? So is everyone comfortable with this? If not, I will find this for you later so we can go through. Some of these slides I am going to skip. This will talk, we're basically dealing with math here, and my philosophy on math is there's no one way to do it. So I'm going to show you the way I do things, kind of give you a, actually, I'm going to show you a way that you can do things. I do things in my head. I'm a little weird that way, so I calculate in my head. So it's kind of hard for me to explain to you that way. This has a different way of showing on this area too, so I'm going to show you that. I don't like that way, so personally, but you guys might, so I'm going to show you that. So you guys may have to reference this slide lecture to figure out the way that works best for you. Again, as long as you come up with the right answer, I don't care how you do it. Fair enough? Okay. So, because we had some people who didn't know how to calculate math yesterday, wrong. What?
Nothing.
Oh, okay.
What are you talking about?
So, I don't know.
I can calculate math, I just couldn't read a stupid syringe.
So you're good at math?
I'm not. I'm just going to answer that one as no. If it's a lie, I don't care. I don't want to be tested right now.
Okay. Well, I got to test to make sure you guys are on the right page. Okay? So are you volunteering to be tested?
I will volunteer Eldon.
Perfect. Okay. All right. So Eldon's smart. Okay. So easy. We're going to start off with 5 into 25.
5.
14.
25.
5 into 25 is 14.
It's actually a square root.
Well, now it's 4.
So 5 into 25 is 14.
My average is going to work like this.
Do I have to teach you guys everything?
Yes.
You guys don't get this. 5 goes into 2 how many times? 5 goes into 5 how many times? 5 goes into 20 how many times? 4 times. 14.
Wow.
Make sense?
No. I mean, yes, but I disagree with your answer.
Okay. So we'll multiply this. 5 times 4? 5 times 4? 20. 5 times 1? 5? No? Not working for you yet? All right. Can you guys do addition?
25.
You got 5 of them, right? 4, 8, 12, 16, 20, 21, 22, 23, 24, 25, right?
Try it with like a 12 or 17.
7 into 28. 13 times. There we go. There we go. Now we got math. Perfect. You guys understand now? All right.
How many beers in the bar do you have to try?
I have fun with numbers. All sorts there. So
That can be the test.
that will not be on the test. So I always got to have fun when I do stuff on this stuff. This is my little fun with you guys. And I got to see if you guys trust me, because if I came up with those calculations, are you going to agree with me in the field? I hope not, right? So,
Well, now I will.
yeah, you will. Okay. Zach's with me. He knows my math. Come on, that's perfect. So take 13 and add it up 7 times, you'll get 28. All right. So basically, the fundamentals that we're going to be doing with molecular drug calcs are going to be dealing with grams. This is basically our conversion from standard to metric system. If you guys have got this system down, great. If you don't, my TED Ed that I set out that was just voluntary was just on metric system dealing with grams. So we don't need to deal with meters. Milliliters are the same type of thing, though. Milliliters and liters are going to be our 2 volumes, so that's pretty simple of what we're dealing with there. But I want you guys to be able to have these areas down and know exactly what those conversions are, because conversions are big things. Fortunately, with the metric system, it's actually very simple. We're usually dealing with most of our conversions in changes of 3. So kilos are 1,000 grams, basically, if we're dealing with grams in these areas. 1 gram is 1,000 milligrams. 1 microgram is equal to 1,000 milligrams. The big thing I want you to go in here for micrograms, because you're going to see this multiple different ways out in the problems in there. It's either MCG or this UG. I didn't go, my college did not have a Greek system, so I don't know if you were saying mu. So, could be MUG. But these are the different areas. You're either going to see it written out, micrograms, you're going to see MCG, or you're going to see the UG. I call it MUG, however. So those are the areas that I want you guys to be able to know. These conversions we're not going to be doing. The only conversion we're going to be doing from standard to metrics is going to be weight-based, right? And you guys, I saw everyone got that part right on the test because it was the last question on the test I saw. Conversion of kilograms to pounds, 2.2, okay? So very simple on that aspect. Now here's the thing that I want you to do when we're doing conversions. I'm going to get you guys calculators, and we're going to have these small, those little free cheapy sample calculators that you're going to have for every test. For the test questions, I will check with Gary, but I'm pretty sure it's set because he writes the test. You will use 2.2 on your conversion, so we'll give you calculators for all those. So I want you to use calculators on the test. In real life, are you guys going to use 2.2? No. Use 2. And someone was asking me the other day about numbers and weights and things like that. When we're dealing with weights in these areas, I don't want you guys to handicap yourselves. Okay? What I mean by that is if you divide by 2 in the system out there to conversion down, and that number comes out to 58 pounds, are you going to use 58 pounds for your calculations? Use 60. Yeah, don't handicap yourself. So when we're dealing with medications, and I don't know how much Dr. Raby, because I didn't see his lecture on that or what he talked about, but medications have what's called a therapeutic range, right? So it works within a range of system. Now the difference is with that, that's basically going to help us because when we're checking on weight-based drugs, how well are we going to do? Well, it's going to be different from all of us. So I'm going to ask you, how much do I weigh? How much do I weigh?
208.
How much do I weigh?
200.
So a little bit of a range, right? So if you divide it by 2, that's 100 kilograms. 110. So the numbers are going to change a little bit. When we do some more math, they're going to change on that one. So it just varies from what we go by. So what weight would you use of me on kilograms? 100. Don't handicap yourself. It's easier than 110, right? So that's where I go. I weigh 205. But you can't tell, right? And if I'm laying down on the ground, how much do I weigh? It's a little bit different, right? So we have to estimate these things, and everyone's going to estimate slightly different. So your calculations can be different from your calculations. So I want you guys to be realizing when you come up with these numbers in real life, don't handicap yourself. Find an easy way. Okay? Go with that and go with wherever they're at. But on the test, you're going to follow the 2.2 in your calculations. So you come up with the right answer. Because the test answers, if you switch something around, you'll get one of the right answers. It's the wrong answer. But we basically have gone through the problems and we've calculated them with switching numbers around to get an answer. So you may think, oh, I got the right answer, but you guys need to make sure of that. 14. Remember that. Put that on the test, you will be wrong. So these are our basic areas here that we're going to be going through. When we're talking about drugs, we're talking basically as grams as our weight. So does anyone not feel comfortable with conversion of grams? Everyone's got that down. Okay, because that's going to be a key point. If you don't know, then basically talk to me later. We'll go over that or review. That's silent. That's the old one. So anyways, however you guys want to do, check up, make sure you guys can do those conversions in your sleep because that's going to be very important and knowing exactly how to do that. So now when we are going and we're going to start doing drug calculations, the big thing we have to do is we have to come up with a solution. And I'm going to show you basic formula that you're going to use from standard drug calculations all the way up to weight-based drifts. That's a formula that I like to use when doing math. And so this is basically where it's going to start on. So they call volume on hand by dose on hand. So basically, when I get on that, volume is usually calculated in what? In liters in type of area, but we use most commonly milliliters. because we use smaller concentration. But yeah, liters is our area. And dosages of drugs, milligrams is what they are. Our grams are weight-based. So this is going to be our standard format. And then we're going to find out, usually, what are we looking to give? How much? So that's going to be the standard area. We look for the volume we want to give based on the concentration, based on the desired dose that we want to do. And this is a formula to get what we want to give. So as we're looking for this, we're basically going to give a medication. And we gave meg sulfate yesterday. You guys were drawn up in my group. Those dosages were completely wrong, by the way, because we were using small syringes. But if we were doing that, we got to identify how much we were going to give. What's that?
Nothing, sorry.
Oh, no, feel free to jump in. Okay. So basically, we just need to figure out how we're going to be doing that. So my big thing is what we got to do is we got to organize. We always basically have to get things set up. And where I want you guys to be doing is showing your work on the initial aspects when we're dealing with this, because as we get more concentrated and we start doing, and I showed a couple of this yesterday, when we get into drip calculations, we're going to have to give a milliliter over milligram. We're going to have possibly a kilogram and possibly a microgram per kilogram. And then we're going to have maybe another milliliter, and then we're going to have drops, and we're going to have minute, and we're going to have, actually this would be here. So we're going to get set up, and if you don't have these whole calculations right to get drops per minute, if you don't have these numbers all set up correctly, you guys are going to get the wrong answer. You guys are going to get flipped out. So I want you guys to start off with a simple aspect and always be writing what you're putting in there. Is it milliliters? Is it milligrams? Is it kilograms? Is it micrograms? Whatever. Putting those out and writing it out in the work, so that's your way to check yourself. Did I do my conversion? Did I have micrograms down here and I have grams up here? Or milligrams? Did I make those conversions? So I want you guys to be able to do this so on the test-wise you get it straight. Once I teach you guys all this stuff and I know you guys all know how to answer these questions, then I'm going to show you the shortcuts. But I'm never going to show you the shortcuts without having you guys figure this out. And once we get a little further into this, I'm going to give you some extra credit questions too that I have. So I'll give you some other opportunities to get some points there. But it's basically knowing these math and getting that initial formulas down. But once you have that, I'm going to teach you what I call the 2 a.m. math. You know, so if you're working a night crew, it may not be 2 a.m. math for you. It's 2 p.m. math for you whenever you sleep, type of thing. So let's start with a simple formula here. Our protocol gives the 2 milligrams of Valium, which is also known as diazepam. Versed is midazolam. So you guys will get used to that, so we're going to concentrate on that. I'm also going to give you guys a bunch of drugs today, little vials, and we're going to start calculating some stuff so you guys get used to what we're carrying. So the IV to be administered for a seizure patient. So we have 5 milliliters vial that contains 10 milligrams. How many milliliters are you going to draw up? So how would we set this problem up? Let's identify what we got to get. So how much are we ordered to give? 2 milligrams. Okay. How much do we have on hand?
10 milligrams per hour.
Okay. So if we go back to our formula, here's what we have. So our desired dose that we want to give, right, is 2 milligrams, and we have our volume on hand. Basically is going to be set up for coming in. So let's take this area here. We have 2 milligrams is the amount we want to give, and we have 10 milligrams in 5 mils. So I want to give 2 milligrams. That's my dosage that I want to give, and I want to find out how many milliliters. This is the way I set things up. Okay? So what is my dose on hand?
10 milligrams per 5 minutes.
Okay? And remember, we set up the milliliters up here and the milligrams down here. So I've got 10 milligrams in 5 mils, right? Is this making sense? Pretty simple, straightforward. So basically what I want to do is I want to give the amount that I want to give, and I got to take the concentration. So if I set up my formula, what do I want to get? How much am I trying to give? And I can take my concentration so that I can cross out. If I multiply across this, milligrams are going to divide out, and it's left with my mils, right? So is the formula set up good? Because if I set it up 2 times 10 divided by 5, and I don't use areas to cross out, I can make mistakes. Does that make sense? So this is the initial area that I want to set out for you. When we do drips, we're going to change it a little bit, but this is the formula I use. Pretty simple across here. So what do we do? 2 times 5 over 10, cross out 1 mil. Pretty simple math, right? Easy? Okay, just making sure we got that here. So once we get these out, there's different ways to do this. So this is the area that they talk about. So when you guys look on this slide, this one's called ratio and proportion. I like this version better. This is simpler for me to do, but this ratio and proportion is another way you can do this. I'm not going to go over this too much, but basically what I want you guys to do is take a look at these slides here. See if you like this system. Find out what works for you as far as getting these initial calculations in. So they do a different proportion up here, and they do what's called cross multiplication, and they set up this here. I find this way more confusing. You guys have all these slides in front of you too? Okay. So they do all these things like that and come up with these areas. I don't like that system. So if you find that system works for you, use it. Find something that works for you in that aspect. My aspect is looking at a little bit different. So what I'll do again is I'll take this out here, and here's my formula that I use. So it's that same kind of area. And what I want to do is I always want to take, when I'm getting a drawing up from a vial dosage, I always want to give my dose here times my concentration on hand to equal my volume that comes out play. So let's leave this in place for a formula here, and let's set it up. So let's say I want to give 1 gram of meg sulfate, because we had that area the other day. So my ordered dose is 1 gram. My concentration comes in 4 grams per milliliter. So how many milliliters do I need to draw up to get 1 gram? How do I set the formula up?
1 times, then you have milliliter over gram. Do 1 over 4 equals quarter.
Pretty easy, right? Anyone have any problems with this? Yes, you have a problem, or yes, you know? Okay. All right. So that's basically the easy setup. This is where we want to get everything taken care of to start from a basis. So what I want you to do is I'm going to go get out a bunch of medications that I'm going to pass out to you. Sorry I didn't have this set up. I didn't know we were going to do this first round this morning. So I'm going to go grab some medications we do. I'm going to pop some files out to everybody, and I'm going to give you a dose. And I want you to basically tell me how you would do it. We're going to teach the class.
No, that's it. Sure, reject it. Oh, really? Yeah. So, Archie.
All right. So we're going to start with these. I'm going to bring some more out. Pass these out. Okay. Okay.
I don't know what that means.
I know. Who hasn't got some meds yet? Who else? One more? So start taking a look at your vial that you got.
No, it's not.
Okay, so everyone's got your vials, right? These are all medications you guys have seen before, correct? So we're going to do some, yeah,
Mine's in MEQ.
milliequivalents. Yes. So what I'm going to do is we're going to do some drug calculations. I'm going to have each of you start figuring some of these things out for me. Everyone got a piece of paper in front of them or something to do some calcs with? Okay. So I'm going to run a couple of these things across to you. And then we're also going to teach you about these medications and what they're used for a little bit too. So I like to be practical and hands-on. Okay? So Alex, I'm going to start with you. What do you got? Dopamine. Now, dopamine right now, how is it supplied? Do you know? Pre-filled drip bag. Okay. We do actually have it supplied in vials as well. The reason I'm going to tell you this is because I don't know what happens for the future. We had EpiPens for years and years, right? Now what do? We draw it up, right? And now we got back to ampules. We draw it up, why? Because it's cheaper. How often have you guys seen, have anyone seen dopamine be used?
Once in 6 months.
Okay. How many times? Okay. So how long do we have them until they expire? It's the same thing. They're fortunately not as expensive as an EpiPen, but eventually we might go to the point where we mix our own bags. So that's where I'm going to go from this. So what's your concentration?
400 milligrams per 5 mLs.
Okay, so I want to have you give me 200 milligrams
200 milligrams?
of dopamine.
Okay, so
How many mils is that in? So let's again, what's my concentration?
400 milligrams per 5. 80 per milligram.
So I want to give 200 milligrams,
2.5.
and my concentration was what?
80 per milligram.
What is it? How come supplied? How many? 5 mils in there?
Yeah.
So there's 5 mils in the bottle, and how many milligrams is the bottle total?
There's 400.
400. So how many mils are you giving?
Give it 200, and there's 80 per mil, so I'm going to do 2.5 milligrams.
2.5. Perfect. Everyone get that? Makes sense? Okay. So this is maybe something that we have to supply, and we'll talk about it when we get into our drip rates, of basically how much dopamine we're going to give in there. What do you got? Meperidine.
Pyridine.
Meperidine is also known as anybody. Demerol. So Demerol is also another medication. Again, this is probably something we're not going to be using out in the field, but you never know. We get a lot of changes. So what's your concentration? Or how much fluid and how many milliliters? 1 milliliter, 50 milligrams. Okay, so I want you to give 10 milligrams. How many mils?
1, 2.
Are you sure?
Pretty sure.
Okay. Everyone get that?
Yeah.
Pretty easy. So I'm going to go through a little bit faster here now. If everyone's got the concept down, I'll do a couple more of these going through. Just make sure you guys know this. If you do not know this, I am going to do one of those quizzes probably tomorrow with you guys. So with the phones, we're going to do that again. And I'm going to have the quizzes up there, so that way I get to see if you guys got it right or not. So I'm going to have a couple of these up there, so I want to do. So I want to make sure you've got that. After I get this, I want to go through the meds real quick and have you guys get used to those. So what you got?
Adenosine.
Adenosine, what's your concentration?
I have 12 milligrams, 4 milliliters.
12 milligrams in 4 mils. What do we use adenosine for?
It's an antiarrhythmic, so I want to.
What do we use it specifically? What do we use adenosine for?
SVT.
SVT.
So 6, 12, or 12.
Correct. For ACLS at 6, 12, or 12, we're going to probably convert the 12 and 12, maybe eventually. But so our first dose is 6 milligrams, right? How many mils?
Yeah, 2.
Right?
Ruby's got 100.
7? All right, so you got 2? Perfect. Is this too easy? No? Yes? Okay.
I'm awake right now. So.
Okay, so you're awake, so you understand that. So this is basically the things we have to do. Now, one of the things you're going to start finding out, because I'm going to talk to my friend Chris back here, because he just said something for me. What'd you say? About your concentration, what do you got? Single dose of what? Okay, so this kind of goes to what things, most of our medications are medic proof. What do I mean by that? It means we drop the entire vial, right? So if I say I've got to give 6 mils or 6 milligrams, how many mils are you drawn up? 2 for yours, because you have 6 milligrams and 2 million as single dose. So take a look in your boxes, like I said before. Do truck checks on your rig. Make sure your medic doesn't mind you touching the stuff, of course. But look in there. But you'll see most of the dosages that we give as you're learning the medications, they're single dose vial. We drop the entire vial. Or we carry 2 of those, so we have it for the 12. We usually don't carry the 12s like that unless we put it aside, because someone might pull up that aspect and give a wrong amount. So we try and keep it to be medic proof from that. So you see a lot of these vials are going to be just drop the whole thing. So I want you to start getting used to that. Jeff, what you got? Okay, what do we use amiodarone for? It's can use for live dose and dead dose. It's used specifically for VTAC and VFib. And I'm going to throw something else to you out, but it's used in the hospital for SVT. But it's done as a drip rate, not as a set dose. So we use it for a live dose of VTAC, and we use it for a dead dose of VTAC and VFib. So cardiac arrest, it's used, and as long as it's cardiac arrest with VFib or pulseless VTAC or live dose. So what's your concentration? How many milligrams and how many milliliters? What's our standard doses of amiodarone? Does anyone know yet?
300.
So we have 2 doses. We have 300 milligrams that we give as a dead dose, and we give 150 as a live dose. Now here's another thing about amiodarone. Amiodarone is technically supposed to be diluted. We're supposed to dilute 150 milligrams with 10 mils, and we're supposed to dilute 300 milligrams with 20 mils. You guys have ever seen that done? Most people don't. Most people just drop the 3 mils and shoot it in. For a live dose, you can't do that. Live dose, you can't shoot 3 mils in or get your 150. It's got to give a slow dose range. So you need to dilute this. If anyone's ever diluted this, when you drop too fast, it gets really foamy. It's very viscous. It makes a lot of problems. You have to be very careful when you dilute this up. Actually, an easier way to do this, and we're trying to get the county to carry 250 bags. You take that 150, shoot it in a 250 bag or a 100 bag, and you drip it in for VTAC. I know I'm getting way ahead of things, but those are the simple aspects. So if I've got 150 milligrams in there, and that's my, excuse me, I have 150 milligrams in 3 mils, but dead dose, I want to give 300 milligrams. How many milliliters do I have to give? Perfect. Supposed to, but cardiac arrest, most of the time, we just drop that, just shoot it right in, and we put a flush behind it. Some people will take that, put that in, and take a 10 cc flush and call that diluted. But it's just when you give a live dose, you got to make sure you dilute that.
Was it burn going in, or what's the deal with diluting it in the live dose?
Diluting it is so that when it gets to the heart, it's effectively moved because it's very viscous, and we got to spread it out so it gets flow into the heart.
Okay.
So it doesn't get hit with that immediate shock, especially in a live patient.
Would cardiac benefit greatly from being diluted? Cardiac arrest?
Cardiac arrest does, but again, timing. We don't have a lot of time to go up and drawn it up. That's actually why I like lidocaine a little bit better. I'm old school medic, but lidocaine takes math. Lidocaine is a weight-based dose where amiodarone is 150 or 300. Simple on those. Okay, but I want you guys to get used to these areas here. What you got from that?
Single dose.
How many milligrams per milliliter?
There's 1 milliliter here and 0.4 milligrams per milliliter.
Okay, so if you were going to have to give that, so again, your dose was 0.4 milligrams in 1 mil, and you're going to give an intranasal injection. So you're going to give an IN. How many milligrams do you need to give intranasal? So 2 milligrams. How many mils do you need? 5.
Welcome to AMR.
So, and they actually usually carry that because technically, though, our first dose of Narcan through the IV is 0.4 milligrams, single dose. What's our second through the IV? 1.6. So I need 1 followed by 4, so I got to drop 4 little ones. Or that's why you're going to start seeing the pre-filled pack of 2 mils in a syringe that you put a MAD device and shoot 1 nair up, 1 nair up. 1 mil per nair. For those of you who missed that on the test.
So 1 mil per nair.
1 mil per nair.
Then we just threw out 5 milliliters.
So on this one, could we give that IN?
No,
We have to have the pre-filled syringe, so you have to use the.
always just a higher concentration.
Yep. So the pre-filled syringe comes 2 milligrams and 2 mils,
Okay.
and actually there are Narcan bottles out there that are 2 milligrams and 2 mils. But then we also have 5 milligram to get, or excuse me, 0.4 milligrams in 1 mils. So they come supplied 2 different ways. So you got to decide on what you do. So if you have the 0.4, you can't give that intranasal, can you? Because it's too much. Yeah, that's way too much. 1 mil. So if my dose, if my correct dosage 2.2 milligrams, and I want to give it intranasally, how much do I give? Less. I'm giving 2 mils because if it's 2.2 mils in that, I can only give 2 mils. So yeah, you're not supposed to do that. So anyways, we'll go from there. So now I just kind of want to go over some meds real quick, and then we're going to move on with the calculations, but I want you to know where they're at. What you got med-wise? Lasix. Lasix is taken out of our protocols for some specific reasons because it was used incorrectly by multiple medics. Josh has probably had to deal with this at some point in time. Someone has a pneumonia. Pneumonia sounds wet, right? Pneumonia also sounds dry. Pneumonia can sound absent when we're listening to lung sounds. That's the other thing I want you guys to do as EMT is listen to as many lung sounds as you can. I think I've told this to people, but they broke their toe, listen to their lung sounds. Listen to what normal is because you'll know what abnormal is. So if someone has pneumonia and they hear wet lungs and they think, oh, pulmonary edema, and they shoot Lasix in there, and what happens to that pneumonia?
It's flushed out of my body.
No. Dries it out because Lasix will pull it out. And we just made those concrete lungs, and now that patient's got 3 weeks in the hospital trying to get nebulized and break those areas up. So, what's your concentration of Lasix?
100 milligrams. 10 milligrams.
milligrams per milliliter.
10 milliliters. How many mils do you have in the bottle?
10 mil.
You have 10 mils, and how many milligrams?
10 milligrams per milliliter. 100 milligrams.
So you have 100 milligrams in 10 mils. Average dose is double the weight, so 40 milligrams. If I want to give 40 milligrams, how many mils? 4? Perfect. Did everyone get that? So if you didn't get that, basically here's an easy concentration. Zeros will basically cancel out. So I can cancel those two out because they can divide out. This 40 is going to be divided by the below area here too, right? So I can divide that out. So basically I'm going 4 times 1, right? In this case, 4 mils. So simplify your drug concentrations down. Make sure you're aware of how they do it, and I'm going to show you again simple aspects of how to do this. What you got, Will?
Take fentanyl, 50 micrograms per milliliter, 2 milliliters. Wow.
Okay. So what's our fentanyl used for?
Fentanyl is a potent synthetic narcotic and it's consumed as morphine.
So you guys haven't gotten to fentanyl yet. It's one of your medications there. Actually, you guys do, don't you? So what's one of the things that fentanyl will do if you push it fast? What? It'll basically cause chest restriction if you push it really fast is one of the things. So if you got a flail segment chest, take about 300 mics and push it fast, they'll tighten up and stop breathing. Fantastic. Oh no, you don't do that, do you? You get chest rigidity. No flail segment chest anymore. That patient is 100% stable. Dead is good. I know how to fix dead, right? Get them stable, and then you work up from there. So again, know what your dosages are. Fentanyl, the big thing you have to know is what your total dosage is, and it's 3 mics per kilogram is your max dose for that. Our standard dosages, kids, probably 25. Medium-sized adults, maybe 50. Large adults, maybe 100 mics. But play it by ear and how they go. So be able to draw those up. What you got for me, Michelle?
I have FD1 10,000.
Okay.
1 milligram.
Okay. So you got the pre-filled vial. So you got 10 mils. You have 1 milligram. This is in our epi, 1 to 10,000. Okay. So how much do we give to an adult? Anyone seen a cardiac arrest? Okay. How much epi do we give of a pre-filled vial? All of it, right? It's easy. Okay. So very simple. So what do we give to kids, though? Do we give kids the whole thing? Okay. Well, Broswell tapes is wrong. I'm going to show you guys that later. So I'm going to teach you a couple of things. And for those of you who got to play with me, I'm going to show you some other simple aspects. But basically, kids, I want to show you that kids are going to be just as easy. I'm going to do this a little later, but kids are going to be just as easy to figure out. Okay? So for a kid, if I'm going to give this area, I got to give a different dosage. That's basically filled out. So if I need to give a kid 0.5 mils, 0.5 milligrams, excuse me, of epi, how much of this do I give? 5 mils. Easy on there. I have to give 0.2 milligrams. How many mils? 2 mils. Real easy. So I'm going to teach you a formula how you can figure that out real fast for kids. But I want you to know for adults this is easy. But for kids, you got to know how much to push on there. So once you figure out the milligram dosage, 0.6. 6 mils. Easy, right? I want you guys to get comfortable. I want you to treat kids. I'm going to flip basically what you've all been taught. We've all been taught don't treat kids like little adults, right? Cardiac arrest, I'm going to teach you to treat kids like adults. I'm going to take away the math and make it easy for you guys. Okay? What you got, Jeff?
50 MEQ
Okay?
over 1 MEQ.
So what do you got first?
Sodium bicarb.
Sodium bicarb. So sodium bicarb is actually the only medication that is proven in cardiac arrest to actually have success rates. Epi's not proven to have any success rate. amiodarone, lidocaine, and NMR. That's the only thing that's proven to have a success rate. It's not even one of our AHA drugs. Nope. It's not even mentioned. It's the only drug proven to have any help in it. And why does it help? Acid base, right? There you go. So, we got some firefighters in the room. You heard of the 10-minute timer, right? We have a 10-minute timer for patients that are under cardiac arrest too, and I want you to start getting this into your head now. So 10-minute timer is from downtime. Not from the time you arrive, but from downtime. So your 10-minute timer, if that patient's been down for 10 minutes, how do you think their metabolic status is? It's proteacidotic. So by 10 minutes, give them bicarb. You've got to start picking that area, because if they leave acidotic, they're not going to come back. So how much do we give of sodium bicarb to a person on a cardiac arrest? How much do you guys see? It's 1 amp. Again, the whole thing. That's kind of what we do. So I'm going to teach that. But the actual dose for that is 50 milliequivalents per kilogram. Milliequivalents. Sorry, that's my handwriting. But it comes out as milliequivalents. So how much are you giving me?
No, wait, no.
No. How much are you giving me? How much did we determine my weight is in kilograms?
No. 5,000.
No. That's how much. This is how it comes supplied. The dose is 1 milliequivalent per kilogram. So how much am I getting? 100. So how much is in that amp? 50. So you need to give me 2 amps to get the correct dosage. So be thinking about that. So in a 75 kilogram person, 1.5. In a 25 kilogram kid, half. Perfect. Those are the things I want you guys to know. Easy math on those. What you got, Trevor?
I have the Tomidate. It is 20 milligrams per 10 milliliters. So 2 milligrams per liter.
Perfect. And that's where I want you guys to be going down to. If you can calculate this out. So 20 milligrams per 10 mils, or if we simplify it, 1/2. So for every mil, there's 2 milligrams. So if I concentrate in my head, if I want to give 8 milligrams, how many mils do I give? 4. Half. So RSI, you guys are going to use succinylcholinase and you're going to use etomidate. That's a sedative. Now for your guys' records, you guys are going to have, for National Registry, here's your range, right? So that's for etomidate. Okay? What I want you to know is you're going to know this and you're going to know this. This is sedation. This is cardioversion. Cardioversion, sedation. And this here is going to be for RSI dosage. There is no 0.2. So they give you a range. I want you to know the range. I want you to put those numbers down because that's National Registry. Real life, you get 0.1 or you get 0.3. There is no 0.2. Just so you guys are aware of that. But this drug, because RSIs we have to do very quickly, I want you to, again, you come up with the milligrams you want to give. Divide it in half, that's how many mils you draw. So that's where I want to get you guys used to it. So once you come up with the concentrations, you're going to know that offhand. So when we start doing RSI, which we're going to start teaching tomorrow, you guys can pop up with dosages real quick because we're not going to ask you how many milligrams you're going to give. We're going to tell me how many mils you draw. Because that's what matters, right? Everyone come up with the milligrams if you do math. But how many mils are you drawing out? That's more important, and that's what we're going to see. When I test you in my scenarios, I'm going to say, okay, show me your sucks and show me your etomidate, and I'm going to look at the mils, and I'm going to see if you drew it up correctly. Because that's what's more important, right? Because we can give, and say I'm giving 1 mil of epi, and give what? 0.1 mils? Did you do that to me? No. I'm not putting you on the spot or anything like that, so. Okay. So we can say we gave the right dosage, but we may physically have drawn it up incorrectly. So that's the part I want you guys to be having down. This helpful? Okay. Okay. So I'm going to get to more math here in a minute, more solutions. But I think this is, yeah.
So with this, we're going to need to do 1.5. We're going to do RSI for you since you're 100 kilograms. We're going to need 30 milligrams of this. Correct?
Correct.
So then when we're drawing this up,
15.
is 15
mils. Right? 30 milligrams
Right,
divided in
15
half,
mils.
so 15 mils, yes.
So when we're drawing this up, okay, this one's spent, go to the next one, we need to just keep that same amount in there.
Yeah, just try to more.
Okay.
If you don't have enough, so I'll give you the, for instance, of Narcan. If I need to get 2 milligrams of Narcan, and I have 0.4 milligrams per milliliter, I have to drop one, and I have to keep adding to it until I get my 2 mils. Does that make sense? Or 1.6. So if on there you're saying you don't have enough, is that the question? Or
Just the process of going through, because I don't think I've ever seen, granted, I haven't really watched medics on scene when we're doing this, but I don't remember seeing them pull out a bunch of vials.
depends on how many do. How many's in that vial? 20 milligrams total.
Yeah.
Yeah, so the vials I carry 40 milligrams in them.
Okay.
So that might be just a smaller one that we have. And everything comes supplied a little different, but mine in my box has 40 milligrams in it. So I'm usually pretty good.
I know all the departments are different, but why would, say, my department use Zirconium over Polyday? Is there a difference between two medications, or?
What'd you say?
We use Rock instead of Polyday.
So different meds, right? So Beck and Rock are what? Paralytics.
Yeah.
That's a sedation. That's not a paralytic.
Okay.
So etomidate is my sedation. So your two sedations for RSI, which you're going to get into, are Versed and etomidate. Versed is a opioid. It's a locked up drug. And for me, and I don't know about you guys how you go, KCFR, you guys have packs on you. For me, mine is locked up in my drug box on the engine or the road. So if I'm all of a sudden have to do an RSI and I'm away from my drug box, I got my etomidate and that doesn't have to be locked up.
So the accommodate's shorter acting than Versed, correct?
Not necessarily. They're equal as far as their length of action. So it's all in the dosage. So yeah, so again, we'll get into RSI tomorrow, but basically we have to sedate our patient first, and then we paralyze. So your Beck and Rock and Sucks are paralytics. What you got for us now?
Medium sulfate.
Okay.
2 milliliters, one of those vials.
2 milligram single dose vial.
2 milliliters.
2 milliliters, but how many grams?
1 gram per milliliter.
1 gram, 2 milliliter, megsulfate. Megsulfate is the most underutilized medication in our med box. Mostly because people don't know how to use it. So I'm going to be teaching you guys how to use this medication, because what is megsulfate used for? What do you think it's used for?
Torsades and preeclampsia.
Asthma, BP control.
Okay. So everyone thinks eclampsia and torsades. Torsades is the unicorn. We barely see it. When we see it, it happens for a short period of time. Although I'm going to talk to you, as you talked about commotio cordis, I'm going to talk to you about more uses for it that's out there. But what's that?
Is it used in commotio cordis?
Absolutely it is. So, but basically what I'm going to tell you, though, is it should be used in your severe asthmatic patients, and I have never seen it used personally. But it depends on those areas because it's a smooth muscle relaxant, too. So our dosages you guys are going to learn for the field are 1 to 4 grams. That's going to be your area on there. We basically use 1 to 2 grams or 2 to 4 grams based on how we're using it. So again, easy math on there, that's 1 gram. So if I need to give 2 grams, 2 vials. So you're going to see our medications are going to be really easy to drop on there. Sure.
Rocuronium.
Rocuronium?
Provident.
Okay.
10 milligrams per milliliter.
Okay, and what's our dosage of rock do we give people?
600 micrograms per kilogram.
Okay, so, and the only reason I'm bringing this up, Trevor asked me a question the other day, because what do I got here? If I give micrograms and I got milligrams, I got to do a conversion, right? So you can treat this as 600 micrograms, or you can treat this is equal to 0.6 milligrams per kilogram. Same thing there, right? So again, another paralytic, non-depolarizing paralytic. We'll get into those areas too. So a little bit harder math with this one because we're not doing even numbers, but it's not that bad, right? Okay. So if I've got a 100 kilogram patient, how many grams, or excuse me, how many milliliters am I going to draw up? So I've got a 100 kilogram patient. I got to do a little extra math, don't I? So I got to times it by 0.6, so I'll use the decimal point over, right? So I've got 60 milligrams is my dosage, right? So how many mils? Pretty easy? Okay.
So is there an advantage to memorizing that dosage in the micrograms versus 0.6?
It all depends on how you do the math. So, and I'm not going to tell you how, I'm never going to tell you guys how to do the math. I don't care. The only reason I care about you guys showing work on your test is to make sure that you're marking out milligrams, kilograms, milliliters, micrograms, all those things so they balance. So if you guys do something wrong, I can go back and say, oh, here's the step you missed. Because when we get into drip rates, I have people who are always flip and switch up, and they weren't putting milliliters, milligrams, those things, so it was hard to get them. So once you do that, the formula will come. Once you guys get the formula down, you get used to it, you start doing it in your head all the time. Yeah, formula. Diphenhydramine, which is also Benadryl. What's our dosage? 25 milligrams in.
This is favorite milligrams per milliliter.
Okay. What's our dose to an adult? We can go up to 50, depending on how the case we're using on anaphylaxis. We've done other reactions on there. So again, usually we're pretty easy on as far as our dosage is there. So if I have 50 milligrams in 1 mil, and I want to give 25 milligrams, how many mils am I drawing up? 0.5. Perfect. What you got?
Calcium gluconate.
Okay.
10 milliliter single dose vial.
Perfect.
0.465 MEQ per.
Okay. So calcium gluconate, I didn't know. I grabbed this one. I'm going to take this one off the table because this is actually a milliliter we give up. It's a set dosage. It's not based on milli equivalents, but we'll talk about calcium gluconate. Mostly our big use for that is going to be calcium channel overdose.
Same thing.
Okay,
Single dose vial.
so the calcium gluconate, calcium chlorinate. Calcium chlorinate is a different dosage. Calcium gluconate gets drawn up as a vial. But usually it's going to be for calcium channel blocker overdose.
Sucks.
Succinylcholinase, again, your dosage is 1 to 1.5 milligrams per kilogram. That range is out there. I'm going to tell you for sucks, I usually go to the 1.5. I just go to the high rate. Go big or go home. Depends on what you got to use it for. Depends on the dosage. That's in Spokane County. That's our first line drug as far as utilizing it. Know your contraindications, because we'll talk to that big time on there. But how many milligrams per?
20 milligrams per milliliter.
And how many mils in the vial?
There are 200. I'm sorry, there's 10 mils in the vial.
There's 10 mils in the vial. So how many milligrams are in here? 200. So I'm a 100 kilogram person. How much are you going to give me? 150. Do I have enough? Absolutely. So we have enough in those vials. We usually carry 2 vials in there in our bags, but make sure you have enough based on your concentrations. What you got?
Epinephrine. 1 milligram per milliliter.
So 1 to 1,000 epi. Here's where you guys are going to have area, and I got to talk to some of the groups from that. So I'm going to briefly go from this, and trust me, we will get a break and we'll get some other stuff done, but hopefully this is valuable to me. I think it is. So you got epi, 1 to 1,000, okay? Comes 1 milligram in 1 mil. It's how it's supplied, okay? We have an epi shortage. I need to give 1 mil of 1 to 10,000. How do you do it?
Take it. Flush.
Split out 1 mil.
So I need to take this full mil, and I need to add it to 9 mils of normal saline, and now this becomes 1 to 10,000. There is no commas, but I'm just doing that first. So you see 1 to 10,000 versus 1 to 1,000. But we are in a shortage, so those pre-filled syringes, like you have, Michelle, are basically going away, and I've had 2 different arrests where we've had to remake these out there. So I'm going to show you some quick ways to do this, but I want you guys to know how to do this because you may be doing this for your medic as well. Yeah, Josh. We only have the 1 to 10,000. I haven't had that.
You'd have to get 10
What's that?
Get 10 mils and then 1 to 10,000?
You could, but then, so here's, what are you giving it for? Let me ask you that question. So cardiac arrest, I wouldn't give 1 to 1,000. I'd only give 1 to 10,000. So the area that I would be giving it, so this is the aspect that will answer your question. It could be the reverse, but I have not had this situation, is in the IM dosage. So IM dosage, you give 1 to 1,000, and your dose is going to be for an adult 0.3 to 0.5 milligrams. So you couldn't give that. But what you can give is you can give 1 to 10,000 IV, and it's the exact same dosage. So there, what's 0.5 milligrams in 1 to 10,000? How many mils is that? It's half. So I can give 1 to 10,000 IV, but I have to give it in this dosage. You give it the same dosage.
That would hit it quicker, though, right?
It would hit them faster, but again, we always recommend the IM dosage, 2 IM dosage. But if you didn't have 1 to 1,000, the only indication would be for anaphylaxis. You'd have to give an IV, and then you just give the 1 to 1,000 IM dosage in IV.
Can we just push a milliliter out of 10 milliliter flush and drop 1,000 of that? 10,000.
You could, but that's a little bit more difficult as far as pushing it in and pulling it out and stuff. I'm going to show you a faster way. There's faster ways to do all this stuff, so I'm going to show you fast ways later. Different ways, different things to the thought process. Where are we at? I'm going to get through all the medications we have here, and then we'll take a break.
So 5 now.
Okay?
And this is a 5 mil, single dose, but it's 25 milligrams per 5 milliliter, or 5 milliliters.
So you have 25 milligrams in how much?
5 milliliters.
In 5 mils. Okay? And if I want to give 10 milligrams, how many mils do I draw?
2.
Perfect. So I want you guys to be able to get this and figure out a formula so you can figure out that. What was diltiazem used for? Atrial crib, atrial flutter. Well, even without, but we're usually in a rapid rate. We'll use it for, so when it's not SVT. So SVT we don't use this for, but it's basically rapid rate atrial crib, atrial flutter. What's that? Yes. It goes to slow down the heart. What you got, Zach?
Dansitron, 4 milligrams per 2.
Oh, Dansitron. What is that?
Zofran.
Zofran. Okay. So, and the other thing too out there, we might get Phenergan, we might get Mepergan, we might get Compazine. Basically, it's to help with nausea, right? What's your dosage?
4 milligrams per 2.
4 milligrams per 2 milliliters. How many do we give to a patient?
4.
We usually give 4 as our starting dose. Whole vial. See the trend here? Medic proof. Give the whole vial. So.
Zofran.
Same one. Okay. So same thing. Sorry about that. What you got, Ellen?
I actually have a box. So I've got dextrose. It's got a 25 grams per 50 milliliters. That's already from the alcohol. That and has 25 grams per milliliter.
So dextrose. Here's the other aspect of it too. How much do we give to a patient who's got a blood sugar of 40? People usually talk about giving all of it. Technically, we can give all of it, but usually if we give all of it, it shoots them up, and then you take their pressure up, they're like 200. So you can consider giving less than that to start and see where it's at. The hard part is this sugar gets dissolved and used up very quickly. So we can't sign a release on a diabetic that we've given sugar to, correct? Oh, we can? Oh, okay. Yes, we can, right? So what do we have to do before we can sign the release? We have to give them complex carbohydrates and other things that are going to last, because this dextrose will wear off real quick. So that's why we do peanut butter sandwiches, juice, other things like that. So we got to make sure they maintain it when they live. So I can give them less than my 25 grams, and most time I give them 12.5 grams. So how many mils do I give? 25, half. Usually kind of where I go. Then I just keep it standby. If I need to give them more, I give them some more. So I'm going to throw a little twist in this because we're having fun today in medical math. So kids, yes, this is fun. If you're not having fun, I'll get you there. Don't worry.
Before we start.
So basically in kids, if they're under a year of age, we have to give D10. If they're between a year of age and 8 years of age, we give D25. So I'm going to give you this. I've got a kid who weighs, let me see, a 3-year-old weighs 15 kilograms. So I had a 15 kilogram patient. So I need to give them 30 mils of D25. How do I make it?
What do I have? Drop another.
You have 25 grams and 50 mils.
So you drop another.
So here, let me give you this. I'm gonna give one person who wants to answer this question for me. How are you gonna do it? Explain to the class. Come up here and show them. Open the box. Can I get one of your little 3-way valves? Nope. So this is how it comes supplied. Go ahead, pop top. Okay, so we pop in there. So how are you going to make that into D25 and give 30 mils?
Well, I'm going to get one of your little 3-way valves.
You don't have one of those.
D25 is half the concentration of D50.
So how are you going to mix it though? How are you going to get there?
I need half and half. So I need half of this to be normal saline, and I need half of this 30 mils to be the D50.
So how are you going to do that?
With your little 3-way valve.
Well, just explain to me. Let's say you don't have a 3-way valve, but you've got a 1-liter bag of fluid.
A 1-liter bag of fluid?
Yep.
I drop, I grab a 30 mil syringe, drop 15 mils of NS out of the bag, and then.
So I'm going to give you an easy way.
You just
Okay. Good. Not good. That's one way. Nope, that's one way, right? It can be done. How would you do it?
I would take that, spray out half of it, and then load that back up with.
There you go. There's another way. So you're on the right track. You're doing exactly the same thing, but for quicker, shoot out half and fill up with half. You have the exact same concept down, but it's just doing it. So I'm going to train you even a faster way to do it later. I'm going to do it today. But shoot out half, fill up with half.
Can you draw it up?
Yep. I can fill this up in there. It's still a syringe right here. So I can pop into this. What I end up having to do is pop into my drip set. There's a lure lock in, and I can pull back and add fluid. Because that's how I refill these. Because this technically could be dextrose in here. Because I open up the box, so I'm assuming it is. But in most of the other ones that we've actually used, they're not dextrose. They're filled up with water. So.
I got a question.
Yeah.
On that box, why did they already have it dumbed down and have the 25 grams per 50 milliliters and also have the 0.5 grams per milliliter?
For the exact same reason I just told you, because you have to make D10 also, right? So if you have to make D10, it can tell you how many grams is in the mill, so I could actually do exactly what Will said, and I could shoot those certain grams into another syringe and then drop the fluid in there too. So it just is different ways so you can calculate. There's no right or wrong ways in medicine, in math. Get to there however you need to.
So it just basically did the math for us and put it on one box.
Correct. And that's what a lot of these things do. A lot of these will tell you how many milligrams is in the vial and how many milliliters in there. And then you might see a side note next to it that says, you know, whichever one we had up there that was 200 milligrams in 10 milliliters. It might also say 20 milligrams per milliliter. So it does the math for you in a smaller version.
So is that box saying that there was a total of 25 grams in it, or 50 milliliters?
There's 25 grams in 50 mils, which comes out to be 0.5 grams in each mil.
And then there's 50 mils in that pre-filled.
50 mils in that. So there's not 100 mils.
Okay.
So if I want to give 12.5, I know I give half, or 25 mils equals 12.5 grams. Okay. Last one, what you got?
We have atropine sulfate, 1 milligram for 10 milliliters.
Okay. So what do we use atropine for?
Increase the heart rate.
So-
Or OPP, iron phosphate poisoning.
Perfect. So we have 2 dosages that you have to know. So 0.5 milligrams, and then we're usually giving 2.5 to 6 milligrams for organophosphate poisoning. So we have 2 dosages on there. And we usually have a different one for organophosphate because it comes in a higher concentration. So
As cool as it is in the movies, we just go straight to the chest. And suddenly-
I have never given it, so, and I hope I never have to. I'm here on organophosphate poisoning, right? Everyone knows this? I blocked it out. I'm that far away. So, so we have 1 milligram in 10 mils, and I want to give half a milligram. How many mils do I give? 5 mils. So we give half of it.
Of course, organophosphate put in the also in some herbicide that means great.
We'll see it on farms all the time.
Right, so
Oh, it's more common than you see, but again, I'm here.
I spray this stuff.
Yeah.
You have to
So-
the distance with it.
Yeah.
So
in our area.
It is definitely possible to see. Well, even around here, they have plants that make it. So
Someone just had one not too long ago, where the
yeah. No, it is possible. We'll also talk about some other poisoning, nitrous and cyanide poisoning, and all different things like that that you guys could see also too. People pull it out of fires and things like that. So, all right, helpful?
Yeah.
Okay. So I'm going to stop there today because you got the basis down. So what I'm going to do next is we'll take a 5 or 10 minute break. We'll go then either into the lab or we'll go into the whatever it's called, the MCRIT podcast. So that'll be the next thing we do, and then whichever one we don't do on there. Tomorrow, I think I'm doing, it's either tomorrow or next week, I can't remember. I'm doing more drug calcs. Next one, we're going to go and start getting into drug calcs with drip rate. So I'm going to give you some sample stuff and then a test. So I want you guys to practice knowing these formulas really easy. You got a question, Matt? Yes. The idea is if we have a lab tomorrow, so depends on how quickly we get stuff done in the morning. I wouldn't mind getting you guys out early before Thanksgiving. So if you need to leave at a certain time and we're not done, we are into labs tomorrow. And if you have to go or you want to go because of weather conditions or anything like that's upcoming, let us know. We're flexible on that. I always am. Same way when it comes to us cluster. If you guys are going towards a pass and you're like, I want to beat traffic, it's a lab tomorrow in the afternoon. You need to skip the lab. Let us know. You just have to make it up. Fair enough? I'm always easy going on you guys on that aspect. Like I said, you communicate with us, we're going to help you out. I'm the same way. If I were to travel someplace, I'd want to leave early and beat traffic. So if you want to do it, just talk to me afterwards and we'll set up and we'll figure out what you may miss. And that goes for everybody. All right, so 10-minute break and then we'll come back. Yeah, if you guys bring back me your meds, or just come up and leave it up on Professor Brian's table.
Do you have
Yes. Gary's got a whole bunch of these ones on there. I don't usually hand up, but what I'm going to do is I'm going to send out some test things on there, and we're going to have a little play set tomorrow or the next time I teach with the quizzes. So, and then I will also send that. I've got something else I'll send out to you guys for practice-wise. But you're also welcome to take any of these anytime and come up with your own concentrations.
Okay, well, that's all I can do.
On December 4th, depending on the Seattle Sunday for the Seahawks Sunday game, so depending on the pass, it's.
You want an Eagles game?
pretty stinking drastic moves. Yeah.
Yep, it's just a test.
It's so tight out there.
We're going to do a test on Monday, so it would just be taking that at another time. But as long as you communicate with Gary,
I know I see it.
you'll be good.
Like on the ledge, he's leaning into me. It's awkward.
There's a feud going on here. Well, you guys did buy your coffee at the same spot, so I bought it. And you still.
There's
Yeah.
already a gift, yeah.
Yeah. It's already empty. See what he's saying?
I believe my
I paid for it.
Oh, well, that's when you put it together, you just got your girlfriend inside. Gotcha.
Yeah, but I paid for it.